be together at this time. So just to start the meeting, I'd like to take roll call. And so what I'll do is just read through the names. Tom Lang is here. Tom Owens.
Here.
Jim Herman. Okay. Melinda McLean.
Here.
Joe Sarapacillo.
Here.
Mickey Norris.
Here.
George Cleveland.
Yep.
And Shirley Rosenthal Winston.
Miss Shirley's not going to be participating tonight. She called me earlier and has some family matters that she's working through.
Okay. So the way the meeting tonight will be structured is we'll initially have James's treasurer's report, which I'm sure will be fairly brief. And then we're going to have a series of guest speakers. And after the completion of each guest speaker's presentation, we'll have a time for questions and answers. And there'll be 2 minutes per speaker. Since James is the host of the meeting, he will be in charge of moderating each discussion section. After we have finished the presentations by our invited speakers, we will then open it up to a public comment section where people will get 2 minutes to make whatever question or comment they see fit. And again, James Lyons will be moderating that section. And then after that, we'll move towards adjourning our meeting. So what I would like to do is normally at this point, we'd say the Pledge of Allegiance and we would approve the minutes for the previous meeting. But I think what we'll try and do is accommodate those activities for the next meeting when we have things, I would say, more under control, when we're more used to the Zoom meetings, and we'll move forward with the treasurer's report. James?
Good evening, everyone. I am James Lyons. I work for Supervisor Joya. I'm his liaison to El Sobrante. But we'll get right into it. The treasurer's report is simple enough. It is $3,000. And what I also like to add is that this is my first time hosting a meeting. We've done some trial runs. So please be a little patient with me. If you're one of the callers, please mute. I can see who's muted and who's not, but we ask that while the speakers are ongoing, if you can mute yourself to reduce any background noise, that would be appreciated. I know that it may be difficult to acknowledge folks, but we will do our best to do so that everyone can have an opportunity to speak that would like to speak. That concludes my portion.
Thank you, James. And so our first guest speaker is Supervisor Joya, and he'll provide a county update and a COVID-19 update.
Thank you, Tom. And what we may do, since Dr. Farnetano, our county health officer, follows me, while I may talk a little bit about some health issues and then non-health issues, and then Dr. Farnetano, it may be that hearing from both of us and then having the questions, because each of us may answer different types of questions, that may make it easier, because people may ask me some health questions, and it may be good to hear from Dr. Farnetano so we can both answer questions. How's that, Tom?
That is excellent. Thank you very much.
So I want to first thank the MAC for your patience. As you know, this is the first MAC meeting we've now had since the shelter-in-place order was issued back in March. And many things have changed. We'll talk about that. And I want to thank, we've got a good turnout of community members. And we have found at our Board of Supervisors meeting, frankly, which all our meetings at the board are also currently through virtual meetings like this, we're getting good turnout. So that's a good thing, and there's a lot of heightened interest, and that's positive. So as you all know, back on March 16th, Contra Costa County and 5 other counties in the Bay Area were the first counties in the country to actually order a shelter in place. And you'll hear more from the health officer about that and the reasoning. And many people don't realize that under state law, county health officers have the ability to pass these health orders, which supersede other types of laws in the interest of public health. And so since that order, the county has been pretty much on the front lines of addressing it. County runs health department, social services, and the county and homeless services, for example, between March and June, will have spent about $100 million out of our reserves addressing the pandemic and working with our community-based nonprofits and providing services. And we're hopeful to get reimbursed most of that by the federal government. It's not guaranteed, but that is the hope, and costs continue. In fact, one of the earliest things that the county did was to work with local hospitals to increase hospital capacity to handle a surge, and also worked with federal and state partners to set up a 250-bed medical center at the Crane Way in the Ford Building in Richmond. That is still there. The county is still leasing that space, and there are 250 beds set up in there. It has not been needed, fortunately, because there has not been an overload of hospitals. While we've passed sort of the first peak that happened in April, May, as you all know, there's sort of a second wave happening now. The health officer will explain, I think, the reasoning they see behind that. And we are now have more people in Contra Costa hospitals related to the virus than we did at the peak in April. And that's why we're continuing to hold on to the Crane Way, and if that becomes needed. The county has also rented nearly 600 hotel rooms using state dollars to relocate homeless individuals from encampments, some from encampments, the vulnerable ones from encampments, and emptying the major shelters, including the Richmond Rescue Mission, the county shelters in Concord and North Richmond. And the result of that, fortunately, is there hasn't been a major outbreak in the homeless population. We are now looking to potentially buy some of those hotels. One of the things this health emergency makes us realize is there's a challenge, but there's opportunities moving forward to do things differently. We don't want to return homeless individuals back to shelters or encampments. We would rather work to keep them in safe single occupancy housing, and then transfer them to longer term housing, and still have some shelter space, but not to rely on shelters alone. So county's exploring that right now. The 2 hotels in West County that are currently housing homeless individuals are the Courtyard Marriott and a hotel on Cutting and Canal in Richmond. We also have, in fact, at our board meeting next week, we're going to be considering extending the emergency eviction protection ordinance that we passed back in April. The ordinance applies not just to the unincorporated area, but using our emergency powers, it applies to all 19 cities. And it provides for moratorium on evictions, a rent freeze, and a grace period to pay back rent that is still owed, but a grace period after the emergency ends. We extended the ordinance once. It's scheduled to terminate July 15th, but at our board meeting next Tuesday, we'll be discussing extension of it to continue it in effect. The county also has been working to try to connect small businesses with federal monies. Unfortunately, the federal government infrastructure has not been very good at getting money out. So that has been problematic, but county is working to try to link that. We've seen a major increase in demands for social services through the county. For example, CalFresh food stamps. So I want to acknowledge the hard work of those folks on the front lines with our health department and social services who've been really working nonstop since this all started back in March. They're all considered emergency service workers and more, including our public works department, which has worked to set up, for example, the fairgrounds in East County was set up to also handle individuals who potentially needed some beds in the event there was a surge, and again, hasn't been used. And also they helped set up the facility at the Craneway in Richmond. The other main point to recognize is we're entering our budget season. We passed a temporary budget, tentative budget during the pandemic back in May, and we'll have full budget hearings in August with approval in September, because revenues are going to be significantly less, we believe. We haven't seen the full projections for all cities and counties around the state. The property tax assessment values, which are normally established by our county assessor by June 30th, the state has given them till August 10th in order to make that to make the determination. So all of us who are property taxpayers and cities and counties will not know what the tax roll will be for this next fiscal year until August 10th. So that is something you will we'll be able to base our revenues on that. County government, unlike cities, gets much of its revenue as reimbursements from the federal and state government, directly related to specific services we provide, like social services, and we're already seeing cuts from the state. You've heard about that from the state budget. The county treasurer did provide people an extension to pay their April 15th property taxes with a waiver of penalty. You just would have to file a form explaining your hardship. And the governor has actually extended that through an executive order through next spring. So originally it was extended through June 30th, but it's now extended through next spring. And you should contact the county treasurer's office if you have any questions about that. Of course, in the midst of that, we are now facing after the killing in Minneapolis of an innocent Black person by police. I think we have had, and I think this is positive, a much stronger discussion in our society about structural racism, about bias, about hate. I'm going to talk about an issue that's happening in El Sobrante now here a bit later. So the county, Supervisor Glover and I, who've been working on issues related to equity at the county for the last couple of years, have sort of sped up a proposal that he and I had been working on to create an Office of Racial Equity and Social Justice at the county that would link together and expand on the work that's being done in some county departments. The county departments control many aspects of systems that impact structural racism, whether it's health department dealing with health disparities, social service department, and then of course the justice departments, probation, public defender, district attorney, and sheriff. And so we are working with a number of community groups to bring a proposal to the Board of Supervisors soon that will involve a community process where there's a community voice to prioritize what the work of that office should be. Everything from looking at environmental justice issues in land use decisions to the continued strengthened work of the health department and reducing health disparities, to working at disparities in the justice system. 2 years ago, the Board of Supervisors set up a racial justice task force, which had community folks as well as some county departments. And they came out about a year and a half ago with a series of recommendations looking at the justice system. And that work is continuing, and we're hoping that this new office we create will strengthen and quicken that work. Some of you may have heard there's an individual in El Sobrante who has again sort of uncovered his swastika, unfortunately, in his driveway. There was, I think it was about a year ago when this originally happened, and there has been a lot of community reaction to that. I've been working with the Not in Our Town organization, and we are, and James will talk about that in his report, we are, and you'll look for a ramped up campaign to really show that West Contra Costa County does not accept that type of action. And it shows you we have a long ways to go in unfortunately, in our society. James will talk more about the effort that our office is working on with Not in Our Town, which includes a number of El Sobrante residents as well. So there's a lot more I can talk about, but I will stop there and then turn to our health officer to give a report. And then he and I can both answer questions after that. And just to say, I think we foresee that the MAC will be meeting in this form virtually for a while until this emergency is over, whenever that is, and it is safe to be together at a public gathering. So Dr. Farnetano, why don't you take it over from here, and then we can answer questions after.
Thank you, Supervisor Joya. So as Mr. Joya had mentioned, you know, we are in, whether you call it a second wave or the second surge of our first wave, we are seeing very, very concerning trends in cases and trends in the percent of people who test positive, and in the number of people being hospitalized in area hospitals. So today we had 137 new cases, and there are currently about 1,400 active cases throughout the county. And El Sobrante is a small community, but so the absolute numbers aren't that high compared to neighboring cities like Richmond and San Pablo, but per population, it does have one of the highest concentrations of cases. The only 4 cities in the county that have higher rate of cases per population are Bay Point and Pacheco, and your neighbors Richmond and San Pablo. So we have seen, as this has been a recognized trend across the state and across the country, we have seen in our county that the highest concentrations of cases, especially in the more recent weeks, has been in the more diverse communities. And we're seeing higher rates, especially in our Latino community. And you know, some of that may be related to denser housing, more crowded living conditions, people living with more people in a household, and it also may be related to more residents working in service industries and other industries where there's, you know, high contact with the public or high contact, you know, with fellow employees, industries where it's not possible to telecommute or work from home. We've seen our percent positive on our tests, even though we have been steadily increasing the amount of testing we're doing, and we're close to getting to our target of testing at least 2 tests per 1,000 residents per day. Even as we've increased the amount of testing, the percent of people in those tests who test positive has steadily risen, and it's gone from around 3% in May to 4%, then 5%, then 6%. We're now at 7.1%. You know, a significant number of those are asymptomatic individuals. So just looking, we don't have precise stats locally, but looking at the state-run sites that the state runs across California, about 60% of the folks who test positive are symptomatic and about 40% asymptomatic. And we know we're probably missing a lot of the asymptomatic ones who aren't coming in for testing. And that's part of the challenge of this virus, is that so many people are either asymptomatic and that they never develop symptoms but can still pass it on to somebody else, or they're pre-symptomatic. So they don't have symptoms now, but they're contagious and they can spread it to people and a few days before they develop symptoms. As Mr. Joya mentioned, our hospital numbers are going up. We peaked at about 44 patients in Contra Costa County hospitals in mid-April. Now we have 57 patients in the hospital. Preliminary numbers for tomorrow are, we're probably going to break 60 tomorrow. And most of those are Contra Costa County residents. It's really an undercount of the number of Contra Costa residents who are in a hospital, because as you all know, for West County, many West County residents get their hospital care in Alameda County, and even the one West County hospital, Kaiser Oakland, Kaiser Richmond, because they're part of a network, they have they transfer all their COVID patients to Kaiser Oakland. We poll those hospitals on a weekly basis. We're working with them to get an automatic data feed, but right now we're doing it on a weekly basis on a manual polling. And this week, Kaiser Oakland had 38 patients in their hospital. This week they weren't able to give the breakdown, but we've usually seen about a third of Kaiser Oakland's COVID patients are Contra Costa County residents. So that's probably somewhere around 12 to 14. And then Alta Bates had 3 residents. So you're looking at, and we there may be we found that there are often 1 or 2 at some of the other Alta Bates hospitals. So you're looking at 15 to 20, more probably closer to 20 Contra Costa residents, most of whom, if not all of whom, are West County residents from Contra Costa County in Alameda County hospitals. On the other side of the 56 who are in our county's different hospitals, only 4 of them are transfers from other counties. So on any given day, when you look at our dashboard and you see the count of how many patients are in our hospitals, that really undercounts how many Contra Costa County residents are hospitalized. Also, where are those folks coming from? Well, most of those people in the hospital were living in their own homes in the community. Like right now, we only have 10 of those 56 patients who came from long-term care facilities. So we do know that it's been devastating when we do have outbreaks in these long-term care facilities. But many of those patients are treated at the facility, and they're not necessarily what's driving the large surge in numbers of hospital cases. Right now, we have 6 large outbreaks in residential care facilities. Those are nursing homes and assisted living facilities, things like that. And then we have 7 additional facilities that we're investigating that have, a single resident case in those facilities. So we have a whole team that goes out and works with those facilities, comes in and does testing of the residents, arranges for testing of staff, reviews all their infection control protocols, make sure they have the adequate PPE, the masks, the gowns, the gloves. But with the numbers, they're really, even though we keep adding staff to this team, they're really struggling to keep up. We're also working in close partnership with a lot of our hospital networks like John Muir and Kaiser, and they're actually providing staff and expertise to those facilities to help with the testing and help with the training. But we have seen, as we have seen nationwide, that once a outbreak occurs in an elder care facility, the mortality rate is so high. So we're doing everything we can to try to prevent those outbreaks and those deaths, including requiring the testing of all the staff on a monthly basis, and baseline testing of all the residents. And again, we've gone through to every facility and trained them on proper infection control and made sure they had all the right equipment. But even with all those efforts, the outbreaks still happen because the staff live in the community. They have to come back to their homes, to their families. They have to go to the grocery store. You know, the virus just finds its way into these facilities. So the best way to protect our elders is really to keep the transmission rate in the community low, which is what we're, you know, challenged to deal with right now. And what we're really seeing locally is what, you know, is being reported across the state and across the nation, is that we're seeing a lot of transmission that seems to be associated with gatherings. So people getting together in homes for parties, for large family get-togethers, gathering in restaurants. We haven't had indoor restaurants open, and we know outdoor is probably safer than indoor, but there's still, you know, still an opportunity for gathering there. Gatherings in churches and funeral homes, gatherings in people getting together for contact sports activities. And so those are things that seem to be, you know, driving the rise. You know, we saw our numbers start to creep up in early June, and then they really started taking off in the last 2 weeks of June, and now they seem to be even more accelerating. And that's the way these, you know, outbreaks and epidemics happen. Exponential curves can start out very, very slight. They don't seem to be a big change, but then it really can start accelerating. And so that's why, you know, we decided to postpone our further reopening that was scheduled for July 1st to open up indoor dining and nail salons and movie theaters and gyms and other things. And a few days later, the state actually came out and required that many of those activities not be open. So a lot of counties had those activities open, including some of our neighbor counties like Sacramento and San Joaquin, and had to then close them down. But we had already decided not to open those up. So, you know, those are the big concerns. And, you know, the hope is that if we can really try to flatten this new curve, and, you know, the tools we have in place are universal masking and social distancing, and those tools are so really important. And there's more and more evidence that universal masking, whenever you're around anyone who's outside of your household, really can make a big difference in decreasing spread. And then staying at least 6 feet apart, and the combination of those two things can be very effective. But we know we don't have, you know, most people are trying to follow those things, but we need to try to get to all of us to have better practices that way, so we can really try to change the trajectory that we are on. You know, as we have seen the surges in other states, we have seen other states, you know, kind of going through what New York City went through, where they started running out of ICU beds. And, you know, it happened in New York very quickly. The first case in New York City was documented, I think, on March 1st. And by the end of March, they were already running out of ICU beds. And we've seen similar things in some of the southern states where, you know, they had reopened and seemed to be going pretty well, and things seemed to be going pretty smoothly by the end of May and early June. And now we've got, you know, parts of Florida, Mississippi, Alabama, Texas, Arizona, worrying about running out of ICU beds. And we're seeing it in Southern California as well now, where LA is talking about being concerned about, you know, within a few weeks they might run out of ICU beds. So, you know, we've been, even with these rising numbers, we're still in much better shape than the rest of the states. Our rates are still lower. Our percent positive rates are still lower, but it's the trajectory that we're on that is, you know, concerning. And we really don't want to go back to where we're shutting down more types of business activities like we had to do, earlier in the year. And so that's why it's really important for all of us to kind of call on each other and our neighbors to really try to do the things we can do now, especially the masking, the washing your hands, staying home when you don't feel well, and the social distancing. We're also, as cases are going up nationwide, we're starting to run into some of the supply chain issues that we were struggling with earlier, especially around testing. So we were having the commercial labs have turnaround times on tests of just a couple of days, but now they've started to back up again, and now we're getting some of the commercial labs taking a week to get test results. And the longer it takes to get your test result back, the less useful that test result is. You've already missed a good part of the window where you should have been quarantining or staying at home. You've missed a good part of the window to notify close contacts who were exposed that they should be staying home and isolating. And so we're kind of running into some of those challenges because a lot of these commercial labs serve not just Contra Costa County, but they serve the whole state or often the whole nation. And so what's happening in other parts of the state and other parts of the nation is kind of impacting. And so we're working with the state to really try to, signal to them and communicate to them that this is a real concern and we really need their help in trying to support the labs and getting their supply chains up and getting their capacity back up so we can get back down to our turnaround times that those lab tests can really make effective, make a difference. Because the whole point of getting tested is to know you have it so that you can separate yourself temporarily, isolate yourself so you don't continue to spread the virus. And so we want to be able to get back to where we were with that. But it has been, very challenging. Even having said that, we are much better prepared than we were in April. Our hospitals are much better prepared. They have better supplies of the personal protective equipment. We understand how to treat this virus a lot better. So we have better treatments. We understand things about limiting intravenous fluids, this thing called prone ventilation, where someone's on a ventilator and they're lying on their stomach instead of lying on their back, about the important use of blood thinners. We have some new treatments like remdesivir and dexamethasone. And so, we are seeing the mortality not as high as it was in March and April. Some of that's because more and more it's the younger people who are getting sick. And we know younger people don't do as poorly as older people on average. And some of it is also we know how to treat this virus a little better, but it's still, it's still a deadly virus. And we've had some of the highest death rates, weekly death rates in the month of June, much higher than what we had in the previous few months.
Chris, can you talk about just last time I saw what almost 2/3 of the deaths were at congregate care facilities? So can you talk a bit about that, and then also where to get tested in West County, because we're being tested.
Yeah, so we are seeing, and that's been a trend, nationwide, that the mortality is so high in these congregate care facilities, nursing homes, assisted living facilities for the elderly, and in our county, about 2/3 of the deaths have been in these facilities. And there's such a high connection between age and death. Not to say that young people don't die, and there's been some tragic cases nationwide of young people dying, including that Broadway actor who died at the age of 41 without any prior medical conditions and spent 2 months on a ventilator before he finally expired. But we know age is one of the greatest risk factors for death. As far as testing, we have been, working to try to, open up testing facilities and try to reposition testing facilities in the areas we're seeing the most cases. So, we have our San Pablo West County Health Center where we have testing. The Lifelong Medical Clinic in Richmond has a testing site. We, a couple of weeks ago, opened up a testing site at Kennedy High School in Richmond. We have a state-run testing site in Pinole. And
then Kaiser Richmond.
And then Kaiser Richmond is also doing a lot of testing as well. And so I know we have a lot of residents of West County who are Kaiser members and get their testing there. We've really pushed Kaiser and John Muir and the other private community health partners to really open up their testing and really push them. We were one of the first counties in our county sites to offer testing to anyone who wants testing, regardless of symptoms or not. And we've been really pushing the community health centers and hospitals to do the same. And they've been coming along. Some of them have been limited based on some of their, again, pipelines of lab reagents and swabs, but as much as they have been able to kind of scale up their operations, they've been opening up more and more of their testing to anyone who wants to test as well.
And just a comment about the delay on testing, because I went down a week ago Tuesday to Kennedy High School to get tested, my family and I, and at Kennedy High they were also offering the antibody testing. I got my antibody results on Monday, which were negative, but I haven't gotten the actual swab test yet, and it's been about 8 days. So the labs are really slammed right now.
Yeah. And we do have a small public health lab that can do some testing, but it's very limited. So we originally were able to do about 50 to 100 tests. We added new machines, and now we can do about 300 tests a day. But that's enough to really focus on some patients who are in the hospital. Patients, we prioritize healthcare workers and first responders, and we prioritize people who live in or work in these congregate living facilities like these nursing homes, because we want to get those test results out, and we can get results for them in a day or two. We're trying to get them within 24 hours, but most of the testing is going through these large commercial labs, and that's where we're seeing the incredible backup in the turnaround times. And I think that's all I have.
Should we just take questions for both of us right now?
So typically we start with questions from the board first, and then we move to the public. And I just have a couple of questions, just quick questions for you, Dr. Farnatano. Thank you so much for your presentation. First question is related to the service workers. So as the economy sort of opens up, you would expect that service workers would have more public contact than anybody else. And because service jobs tend to be lower wage, they would also be associated with kind of higher density housing. So you can sort of see how that would be sort of a locus of the increase. So my question is, do you have any plans in place to specifically target that subpopulation to make sure that resources are prioritized to them, because it seems like they're being hit pretty hard?
We do have our contact or case investigation and contact tracing teams, and so they do try to identify who is living in they definitely focus on the household contacts, but then they also try to identify people who are working in service industries, working in high touch public facing type of industries, and really trying to prioritize the investigations around those individuals and their workplaces.
Okay. Thank you. And I have another question, but I'll just relent so other people have time to ask. So, other questions from the board?
And by the way, Tom, you can ask people to raise their hand on the participant list. You can virtually raise your hand on the participant list. If people click under participants and then raise their hand, then you can see who's raised their hand.
So we're going to finish going through the board members. Tom Owens, you have a question?
Yeah, I had a quick question about hospital capacity. How are we doing on that? What sort of percentage are we at? And do you have a timeline when we may approach full capacity?
So the thing I worry about the most is our ICU capacity, because we know early on in the epidemic, about 50% of people who wound up in the hospital wound up in the ICU, an intensive care unit. Now it's maybe a little lower, partly because of how we're treating it, and partly because of maybe some younger people on average being hospitalized. So it's probably maybe 40% of COVID patients wind up in the ICU. Most hospitals don't have 40% of their beds as ICU beds. They have much less. And so that's the thing, most hospitals wind up running out of first. Currently, if you look at adult ICU beds in our county, we've got about 55 to 60% of them full. And that hasn't bumped up that much. We were more around 40, 50% earlier on. But again, I worry how these curves tend to be exponential. And so I am worried. I think for the month of July, we're not going to run out of ICU beds, but I worry about August because how quickly these numbers can kind of get out of control.
Any other board members with questions? Council members? Mickey?
Yes. Oh, sorry.
We'll come to you, George. Go ahead, Mickey.
Okay.
Hi there, and thank you for your presentations. You had mentioned something about, you said there were 1,400 active cases. Is that in the county or is that in El Sobrante, did you say?
Oh, I'm sorry, that's in the county as a whole.
Oh,
So we define active cases as someone who's either tested within the last 14 days for asymptomatic people, or folks whose symptoms are within the last 14 days. And so that's really about a third of the, it's close to a third of the total cases that we've had. I think our total cases, I can just pull up our dashboard again, about 4,200. So, 1,400 active cases is about, just about a third of all the cases we've had in our county so far have been in the last couple of weeks.
wow. And what was the 137 statistic about?
So that's the cases that were reported today. So new cases reported today.
Oh, okay. So we have no stats about El Sobrante in particular?
Oh, no, I'm sorry.
We do. There's a number of cases.
Yeah, so the El Sobrante stats, let's see, I wrote them down here somewhere.
I can pull them up on the,
Yeah.
and James put the link to the dashboard in the chat. So anyone wants to see that, it's in the chat.
Yeah, so El Sobrante has had 74 cases, and a third of those cases have been in the last 2 weeks in El Sobrante.
Wow. Okay. I have the other questions I have are the tests free, and also is there contact tracing going on in the county?
Yeah, so the tests are free. So that the feds have passed legislation saying all testing should be covered by health insurers without a copay. The state of California clarified that should cover people who are symptomatic as well as asymptomatic. So anyone who gets a test shouldn't be charged by their insurance. At our county-run test sites, we do bill insurance if they do have insurance. If someone doesn't have insurance, we do not charge them. But we do instruct folks that, if they get a bill from their insurance, that they shouldn't have to pay that. They should contest that with their insurance provider, because the legislation says that their insurance company shouldn't be charging them a copay for this.
And contact tracing?
And in contact tracing. So we have a team of case investigators and contact tracers, and we are, scaling that up. For a while, we were really, when the numbers were low, we were able to reach every single patient every single day and reach every single contact. The teams are struggling to do that now, even though we've added more staff because of the sheer numbers of cases. Getting 137 cases in one day, then you have to reach all of them, and then you have to identify who their contacts are, and then reach all of their contacts. So it's been a real challenge, and we are hiring more. We're also getting 30 contact tracers from the state that are virtual available to us, and they're coming online this month. But it has been a real challenge as the numbers have increased so quickly to keep up.
Thank you. George?
Sorry about that. I had to unmute myself and hold up my tablet as it fell over. Doctor, thank you very much for all the work that you do and the information you've given us. And I want to say shame on those people who might be harassing you and your counterparts in other counties for having the gall and the nerve to ask people to wear masks to protect themselves. So my question is, I think I know the answer, but the diagnosis, when someone is diagnosed, they are covered under HIPAA from having to be identified as having the virus or being diagnosed with this. That is correct?
That is correct. And our case investigation team, really works carefully to make sure we are respecting privacy, and therefore we need their permission in order to notify contacts, close contacts, including workplace contacts.
It's very good that you said workplace contacts. The reason being is I work for East Bay Mud, water company in Oakland, and active in our local there, our union. It's a union shop. And somebody who works in one of our departments tested positive. And somebody else is coming to me and saying, hey, he's trying to find some language on the Health and Human Services website that seems to indicate that COVID doesn't apply to us, which is, I'm glad to know, is not true. So I want to thank you for clarifying that. So I will chat with this individual who's actually, frankly, trying to be nosy, trying to find out who it was. It's like none of his business. But so thank you for clearing that up, and that's all I have to say.
Are there other council members with questions? If not, we have some residents with questions. All right, moving along. Ms. Bonner?
Yes, thank you. First of all, I wanted to thank you and the doctor and the supervisor for their hard work and also for the information. My question is for Supervisor Joya. You might have seen the article. You must have heard about the young Black musician who was killed in El Sobrante 3-4 years ago.
Yes,
William Sim.
yes.
Yes. And I didn't know, I've been living in El Sobrante for over 20 years now, but I recently saw an article about how this portion of Contra Costa has been home to white supremacists, and we have been seeing incidents of that.
Mm-hmm.
And then we have the swastika, but instead of banning First Amendment, don't you think it'd be more appropriate to have a memorial for that young Black musician who was killed by hate crime here?
There was a memorial. In fact, I think, James, you read my comments at it. I was out of the area when the memorial happened, and I know I wrote some comments to be read at that memorial. So there was a memorial for him at the time. This was pre-COVID, of course. And I don't recall where it was, but there was a memorial that was well attended by family and friends and community.
I mean, something in addition, something physical to build in memory of him.
Oh, I see.
Black Lives Matter.
Right, right.
To show the stance of the community. If the county is willing to contribute the seed money, I'm sure the community is more than happy to get together, do some fundraising, the civil society, nonprofit organizations. We can get together and come up with something, propose a site to build a memorial, but we do need the support and the seed money from the county.
So let me say this, I appreciate that's a very a very good suggestion. In the work that we're doing with Not in Our Town, you know, which is a national organization, and actually the founder is actually local, and we've been working with them on a campaign that is to speak out, community campaign recording videos against hate, against racism. I think in the context of that, we'll have a discussion about maybe having something that is some kind of positive memorial about how this community stands out. The El Sobrante community stands out, you know, for equity, equality, against hate, against racism, against harm. So I think that's a good suggestion, and we'll talk about what that looks like. You know, frankly, pulling together funding for this is always an easy thing wherever it comes from, but it's more how to have the community have a voice in what this looks like. Because we've been having discussions over the last couple of weeks about the swastika and what's the right response. And the thinking was, rather than focus on the negative, which is the individual with the swastika, is focus on the positive of that this community. I mean, I read that article talking about, you know, about white supremacists in El Sobrante. You know, like you, I've lived in West County. I grew up in Richmond for most of my life, and I know there's always pockets of that. But to be honest, hadn't seen it at the surface. So I'm not sure how accurate that article was in terms that it's a hotbed. There's clearly there's been these incidents. Whether there's more, you know, it's really hard to know. But I think the positive message is the community standing up against racism and hate and looking at what's the right way to do that. What kind of memorial, what kind of symbolic kind of feature in El Sobrante shows the community stands up.
Thank you very much.
So, and feel free to send us your email so we could include you on that discussion as well.
I definitely will. Thank you very much. And then I will talk to the community members.
Yeah.
And if we can come up with a specific proposal, we'll definitely share it with your office.
Great. Thank you.
Thank you.
Ms. Bonner, are you in contact with Mr. Sims' family?
No, I'm not.
Okay. I will get some information to, once you meet with your folks, please contact me. I definitely want to make sure we loop in his family through this process.
Thank you. I will email you.
And you heard what happened in Martinez at the Black Lives Matter mural, which they received a permit for, you know, in front of the county courthouse in Martinez, and then some individuals partially defaced it, and the district attorney has charged them with several misdemeanors.
Okay, we've got one more hand. I see you, Sarah. I'm going to come right back to you. Mr., I hope I'm saying this correctly, Gauss, please unmute yourself.
Cedric, yeah.
Let me see.
Cedric.
Can you see me and hear me?
Yes, we can.
Yes.
Hi. Yes, it's Goose. Sorry.
Excuse me.
So I have lived in El Sobrante for a few years now. I'm a member of FREED. We are a newly formed local community action group between Knoll, Hercules, Rodeo, and El Sobrante, centered around issues of equity and social justice. And we've been having a lot of conversations about policing and different models of policing and how those can be implemented so that we can all have a more participatory role in policing. Are there any plans on the horizon? I did hear about the Office of Racial Equity that you guys are talking about founding. Are there any models on the horizon that are a community oversight board that works directly within the policing structure in the county? I think that would be a way that we could have policing be something that we participate in instead of something that happens to us as citizens.
Yeah, Cedric, your last part cut off, but I think I heard it all. So let me try to respond, okay? And if I missed something. So, in fact, I was in email contact with one of the other members who's a Hercules resident who had emailed me. So I, in fact, invited getting together. She was going to set up something to meet with all of you.
Absolutely love to have you.
So the way, good question. So the way there's many moving parts on this. As you know, every city has its own police department, and it's controlled. The policies of that police department are controlled by that police chief, who's appointed usually by the city manager, who's appointed by the city council. So in Hercules, I know your organization's involved in Hercules, Pinole, and El Sobrante, right?
Rodeo.
And Rodeo. So for Hercules and Pinole, those police departments and those city councils would have control over those policies. For Rodeo and El Sobrante, it would be the sheriff's department. Unlike a police chief, sheriffs are independently elected. The county board of supervisors controls his budget, but he gets to spend it the way he wants, and then he's independently elected. So it's a little different setup than cities. However, a couple things. So at the sheriff's department, you know, they're unlike city police departments. Most of their deputies are working in the jail. So they staff the jail. They provide patrol in the unincorporated areas, and then they have contract with some cities like Danville, Orinda, Lafayette to be the police force for those cities, using the money for those cities. So there has been the Racial Justice Task Force that we set up about 2 years ago, and we can post the online. Their report came out and is posted on our county website. And in fact, actually, there's an opening. I sent out an email for those on my email list. There's an opening on that racial justice oversight body, and anyone interested can check with James, and he could link you to the information. But we sent something out about it a week or two ago. But anyway, they looked at the justice system, right? And if you think about arrest policies, those are 19 different cities in the county plus the sheriff. So there's 20 police jurisdictions. So they looked a lot at policies on arrest and found that there was a disparity in how various cities and how they arrested people in terms of for what crimes, bail. They looked at clearly there were more African Americans in the justice system than their percent in the population. And so they came out with a series of recommendations, and they're doing a lot of good work. Hopefully the office we set up continues to really expand that work. So that is actually a good place to start and looking at the recommendations of the Racial Justice Task Force. I've been the most vocal member of the Board of Supervisors, asking for to set up and I'm sure this will come up again, an independent oversight over the sheriff's department, over the jail. Unlike cities, where if the city council sets it up and this committee asks for documents, they can require the police chief to provide the documents. Because the sheriff is independently elected, any kind of oversight committee we set up doesn't have subpoena power, and if the sheriff doesn't provide the information, they can't get the information. There's a bill working its way through the state legislature that would give these oversight bodies subpoena power, which makes their work more meaningful. We can talk about this more, so that's a little information. So it's really about working with, for your organization, 3 organizations: Hercules, Pinole, and the county.
Yes. Okay. One follow-up question. I'm sorry. With your work with the county sheriff, would you say their disposition is open to that kind of change, or are they more satisfied with the current model of police?
No. Well, let me say the biggest concern because the largest part of the staffing in the sheriff's department is the jail, and the state attorney general had issued a report about a year or two ago about some issues in the jail dealing with, at that time, the immigrant population. He had a contract with ICE, which he's since canceled. There was in which many of us advocated for the cancellation of that contract, and it was canceled. The sheriff canceled it. There were some issues identified, and at the time the board, in fact, the Racial Justice Task Force recommended to have this oversight body. And as I say, my colleagues on the Board of Supervisors were not in favor of that. I think I was the only member in favor of it. because they said the sheriff feels we don't need it. The sheriff basically told the Board of Supervisors that because he's independently elected, he believes he's accountable to the public and doesn't need a separate oversight board. That was his position then. Whether he has a different position today when the issue is raised, we'll see.
Okay. Thank you for your time.
Mr. Goose, can you say your organization's name again? Or can you, if you have a website, can you put it in the chat? I know the acronym is PH something, but because this is the first time a lot of us are hearing it, it may be helpful if you type it into the chat or if you go through the acronym with us all.
And I see, sorry.
Go ahead.
Go ahead, go ahead, Cedric.
So we are Freed, P-H-R-E-E-D, Pinole, Hercules, Rodeo, and El Sobrante for equity and and yeah, we're roughly 40 members spread out across the 4 towns, really having conversations about social justice and racial equity at this moment, but more for just getting everyone on a very level playing field as far as how we live in our society. So we have an education wing and a community wing and a law enforcement.
Great.
Understood.
And I'll post more details in the chat.
And I'll look forward to talking to your groups, setting something up, okay? And
Yes, for sure.
I did see, just because I talked about Not in Our Town, El Sobrante, Sarah Dunham is on, and I don't know if, because in response to some of the questions, if I can, Sarah, did you want to say something with regard to the—
I just wanted to fill in, I want to get your name as well, the person that was concerned about whether the town responded to the death of the murder of Will Sims and what we did. Within days after he was murdered, we had vigils, several vigils in front of the El Sobrante Library. He was murdered across the street from that library at that bar, whatever its name was. And then the year from his death, to celebrate his life, the entire Sims family, I mean, the library, we had it at the El Sobrante Library again. We, I don't know if you're aware, but they have a rose garden outside of the El Sobrante Library. And we had a plaque in memory of Will Sims and planted a rose there, and it's doing fine there. And I'm in contact with the Sims family, and you know, the trial was happening in March with the suspects in this murder, but because of COVID, they declared it a mistrial, which is just a whole nother waiting for justice for this family. But I hope when it starts up again that many of us in the community will attend the trial. But I really appreciate your concern about the family and that happened, because we felt the same way, and it's actually because of that Not in Our Town, El Sobrante got started. And so can I get your name? I don't see your name, the person that was bringing up Will Sims.
Sohaila?
Yes, my name is Sohaila Bana. And I say, yeah, you're either racist or anti-racist. And we have to show we are anti-racist as a community. Yeah. We cannot be passive. We have to be active in this regard and do a little more than what we've been doing so far. Right. And there's a low lot right next to the library, and it would make a very nice park if we could somehow acquire it, you know, put his name on it, Black Lives Matter.
Which lot are you Which lot are you talking about?
There's an old building that has been burnt by fire, hasn't sold for a while, so.
Oh, across the street from the library, you mean?
No, it's right behind the library on San Pablo Dam Road, and it's back.
To the
San Pablo Creek. It's between San Pablo Creek and San Pablo Dam Road.
Yeah.
So we can have something for Black Lives Matter, specifically for William Sim. And it just adds to the pride of the community. It changes the culture and face of the community. We have to do something. I mean, we cannot just keep living in shame that this is the nest of white supremacists. I was participating in a Black Lives Matter And we were faced by people passing by, screaming profanities at us just because we're in the, I mean, there are white supremacists living among us. We need to make a statement. We need to come together, and we do need the support of the local government in this regard. That's why I'm asking Mr. Joya to support the initiative. And I'm sure the community can come together and we can make this happen.
Agreed.
Thank you. And just briefly, Sarah, since I made reference to this community response to the swastika, so I know James is going to report on it in his report. But if you wanted to say
I'm
something,
gonna ask Sarah.
yep, Sarah, since you're
Well, it was,
credited.
John, you were right. It was almost exactly a year ago that in June that it was discovered that there was a 10-foot by 10-foot sort of installation sitting in this person's yard, and it caused quite a media frenzy. I mean, internationally and nationally, news and local news about the travesty of it. And we at Not in Our Town, El Sobrante, set up a petition, which I'll put the link to here in the chat room. And we have gotten like 50, oh gosh, I'll look it up and put it here. It's like an overwhelming response. It just basically says, we do not want this in our town. And but then he covered it up in July, early July of last year. So we thought he had caved to public pressure. And so now it's back embedded into his driveway. And I know John or James are going to talk about what kind of response we're coming up this time around. But that's, and so Hela, I just sent you a private chat. If you'd send me your email, I would love to talk more about all of this with you.
Thank you very much. I just did. Thanks.
Oh, okay.
Okay. So I want to sort of bring the portion with Dr. Farnatano to an end. If there are other questions for Dr. Farnatano while he's on, please raise your hand. If you are one of the individuals that is calling in, I'm going to unmute you because I know there's no way for me to be able to see you to acknowledge you. So 510-262-4203. I've unmuted you if you'd like to make a comment. If not, I'll mute you back. Okay, we're gonna move along. Oh, sorry.
Yeah, I just wanted to thank Dr. Farnatano and Mr. Joya for their presentations. And it's been a really tough road working to deal with the COVID-19. And, I really salute you for doing such a good job of following the science and just doing the best you can, with all of these uncertainties. We're discovering new things every minute, and we're just glad we have good leadership. Thank you.
Thanks, Tom. And I want to acknowledge that Dr. Farnatano and his team, the whole health department, have been just working overtime, amazing. And those of us that get elected to office expect people will, be for or against things we say. But the health officers who aren't elected have been taking a lot of abuse. People at their homes, and a few of them around the state have resigned. In some states, like in Orange County, the Board of Supervisors pressured the health officer to this was a while back, to basically rescind the mask order, the face covering order. And this health officer resigned. The new health officer came in and rescinded the order, and now they've had a resurgence of cases. So one thing we're going to talk about at the Board of Supervisors next Tuesday is how to work with the cities for more effective enforcement. Because frankly, the success of us continuing to reopen, getting people back to work, not filling up our hospitals, not having people die is, as the doctor said, wear your face covering, social distance, wash your hands, and don't go out if you're sick. Because, and it is unfortunate that people are using the mask, the face covering, as a political issue. It is because it is hurting people especially the most vulnerable. And the way we think about it is by wearing a mask, you're protecting the most vulnerable people in our community.
And I do want to thank you, the speaker, for their comments, and I want to thank Mr. Joy and the entire board of supervisors has been very supportive of myself and the health department through this whole pandemic from the start. So we really appreciate their support.
Chris, you probably need to go get some rest. So I'm going to stay on this meeting, but you should probably take a break.
All right.
I know
Well, thank you, everyone.
Right. Bye, Chris.
Thank you, sir. So we are, at this point, we would have reports from the sheriff, the highway patrol, and fire protection district, but I know that Con Fire is not available. Lieutenant Buford did not get back to me. So if you have questions for the CHP, sheriff, or fire, please email them directly to me, and I will follow up in an email with you and them. I will include Lieutenant Buford's email in the chat. He has always said for the last almost 3 years, feel free to email him any questions about anything at any time. So I will put his email in the chat. I will speak just briefly. You all may be aware that there have been several fires from Fremont to Oakley to Walnut Creek, Rodeo and Crockett, all in the last probably 4 or 5 days. And the community warning system is operated through the Sheriff's Department's Office of Emergency Services. And what they'd like to do is, if you have not signed up with them, to go ahead and go to the CWS. I'll include the link to their webpage in the chat, but do sign up for those alerts. You can register an address and they will contact you if there are emergency events happening near you. I'm not a Richmond resident, but I signed up through the program Nixle with Richmond. I think it's a good idea for us to sign up for alerts in the cities adjacent to us. So I'm not sure if Pinole has the system, but I know Richmond does, and I receive their alerts as well. We are getting into the busy portion, well, not really yet. Later in the year, September and October are more of the busy season for fire season, but it started early if you all haven't noticed. So please keep that in mind. I also would like to mention, if you are seeing code enforcement concerns, please continue to send those to me. Our code enforcement officers have been responding to as many of the calls that have come in as possible. So please continue to support the community in calling out issues of concern when you see them. And those are the two large things that I wanted to address.
You want to talk about the No Hate campaign a little, James?
I do, but I sort of set up the email address and we have some general things, but it may be more appropriate, Sarah, if you if you have a few moments to discuss the tag phrase and things of that nature. You may have to unmute yourself.
There she is, yeah.
Just 1 second. I want to get a copy of it just so I can make sure I talk about it the right way. Yeah, okay, so I know you can't see me now, but I'm on my laptop.
We can see you.
Oh, you can see me. Oh gosh, I'm such a novice at all this. So, you know, once this resident of El Sobrante reconfigured the swastika, and there was all this vitriol going along on next door, we got together with John and James in the district supervisor's office to think about how we could present a different narrative or have a different way of responding to symbols of hate in our community. And so we have decided we've just launched a video campaign. It's called Raise Your Voice, West Contra Costa County Against Hate. So we want to launch a social media campaign to show that the majority of our community is united against hate and bigotry. So we're sending this out, and I'm happy to send, I think John was planning to send it out to his newsletter at some point, but
Yes.
and you'll all get it. But please, we're hoping that people will join by making a 10 to 15 second video and posting it on your social media, Instagram, LinkedIn, YouTube, Facebook, Nextdoor, and then also to send a copy to an email address that we have, so we can combine our voices and share with the greater West Contra Costa community. And it's just we're asking just to be 10 to 15 seconds using a prompt, I stand united against hate in West County because, or here's why, or I commit to action to stop racism and all forms of hate. And then you have a hashtag, and there's an example on this introduction to the campaign that we have. So that's the story.
So I will include the details, the tagline, and the rest of that information, and I will send it out to our El Sobrante MAC distribution list. If you are not receiving the agenda when I send it out, my email is in the chat. Send me an email. You can also call me, and I'm happy to add you. But we will include the details in an email that I will send out to everyone on our El Sobrante MAC distribution list. Tom Lang, are you okay with us going into public comment?
Absolutely.
Okay, so we will go ahead and enter public comment. If you are viewing via the video, excuse me, you can raise your hand, you can wave at me for those, and we'll get started. We will begin with Lauren Hanley. Thank you, Lauren.
Yeah, it seems so trivial compared to all the heavy duty stuff that we've been talking about. But so I'm the president of the El Sobrante Chamber. And I just I told some of the community members that I would express, what they've been concerned about. And so there's been a lot of emails and calls complaining about the graffiti and trash and broken trees. So I was just wondering if you knew about how that was being addressed. We have we're associated with a green team, but I know a few of them don't want to go out because of the pandemic. So I was wondering how we can I know like individual business owners are taking care of these issues themselves. So I'm just wondering if the city is planning on doing anything, or if you need help, if we can help you out in any way.
So for the graffiti, that would be a code enforcement violation. And unfortunately, if it happens to your property, you have to remediate it. The county does not provide service to help remediate graffiti.
Okay.
For the issues of trash, if you let me know which business or whomever is reporting it, they can send that. They can always email or call me, and I can help get some assistance in enforcement to make sure that the code enforcement department is encouraging individuals to maintain their properties appropriately.
Okay. And then there was like a broken tree where the branch, I guess it was, I'll have to look up what the street was again. Tom, do you remember what street it was on?
No, I don't. I'm sorry.
Okay. Well, there was like a large limb that was like falling down that people were just concerned about.
Let me know, please.
Okay.
If you can give me a street, an address would be nice, or a landmark identifying what it's near. I will call not code enforcement, I'll call Public Works to come out and have them inspect it.
Okay. All right. That, pretty much the other stuff was already talked about. So thank you.
Thank you, Lauren.
Thank
Miss Marilyn, is it Sarney? Sarney?
Yeah, thank you, James.
Thank you.
I'm speaking on behalf of the May Valley Neighborhood Council's Disaster Preparedness Subcommittee. And we've been discussing evacuation routes, and clearly an active evacuation route here would require close coordination between Richmond and the county and the El Sobrante MAC. We're hoping that the MAC is aware of planning processes for identifying the local evacuation routes and how these, it's being prioritized to make these evacuation routes safe, especially in a wildfire situation. So that's one part. For myself, and I'd love it if anyone could give us feedback on that, because as far as I can tell, there are no evacuation routes identified. Ooh, sounds like John has things to say.
After James responds, I'll say something. Yes.
So I've been in contact with Meredith Gerhart. She works in the Office of Emergency Services and recently contacted me, honestly, out of the blue, about that very thing. So what I will ask you to do, Marilyn, is to send me an email so that I may be able to connect, well, the three of us, so I make myself aware of what's going on as it relates to evacuation routes. But she emailed me Monday out of nowhere with mentioning
How do you spell her last name?
You're gonna put me on the spot.
Oh, no.
I'm teasing.
You can always let me know later.
Yeah.
That's my compulsive editor brain. I also want a personal point, as well as I've complained several times about this to the disaster preparedness committee members. I want to express my concern and my neighbor's concern that care and attention is paid to Sobrante Road in particular, plus the canyons, or I should say canyons, that are fed. There are all these crazy little roads that go like this that all feed into Sobrante Road.
Right.
And it's probably serving about 50 to 80 homes. It's I can't say bad words. It's a death trap. Mm-hmm. And at minimum, it seems that Sobrante Road itself needs work, including cutting back vegetation and trees that are arching and actually going, they're falling over the road. Those need to get out just so people can stay alive. And I also think that I would like to hear how they're going to address this. It's very likely that any wildfire that starts over there is just going to race through the whole area. It's steep canyons. There's no cleanup. As far as I can tell, I guess there's a reservoir there, but I don't know how the water could get to any of the houses there. And that fire is going to come over the ridges and just kill a whole bunch of people that are in areas where there is access, but it's just going to be like an explosion. And so I'd like to hear that more careful wildfire hazard inspections are done over there, and that follow-up enforcement, if needed, is made there, because there are a lot of lower income people who probably can't afford to do the very expensive cleanup that comes with big ancient trees and chaparral and all that. It's a really beautiful area, but it's totally terrifying to drive up there and think about wildfires. And I want to thank Public Works. That's my last bit, because Public Works came out and put a stripe down most of the lower part of Sobrante Avenue so that head-on collisions are far less likely now. And I really want to thank them for that.
Marilyn, Supervisor Joy, before you go, Marilyn, please let me know where these limbs are and the areas. You can take a cell phone picture. I just need a visual to be able to.
James, look at the satellite picture of the area. I would say about 60% of the road is obscured by tree. That means it's the whole length. Mm-hmm. Oh, Linda has her hand up.
Oh, well, there's some other folks with their hands up first. And I don't want to leave until, I know Supervisor Joy was going to make some comments.
Yeah, I wanted just to say, and maybe Marilyn, you're interested in participating in this. So I've been working with a group of of residents across Kensington, El Cerrito, East Richmond Heights, El Sobrante, Richmond. In fact, I'm not sure who the MAC, James, who did the MAC appoint to be involved with this? Because there wasn't someone.
It was Andrew, but then he got off the MAC.
Okay, so this is a good ask for now. I'll ask the MAC to maybe appoint someone. So we have a working group of people, and we've been meeting with the fire chiefs of Contra Costa Fire, El Cerrito and Kensington Fire, Richmond Fire, and East Bay Regional Park District Fire. And we've been having meetings to really coordinate talk about coordination of the agencies over exactly this issue: vegetation management on the East Bay Regional Park properties, prevention and preparation along the urban interface. In fact, one of the meetings I have coming up this week with Kensington residents is the Kensington. They have their own fire and police district, and they're working with our public works department to try to create what's called to have no parking. They have very narrow streets in Kensington that on red flag days or possibly other days is that maybe Public Works designates one side of a street that's an evacuation route, no parking. And I have a meeting on this. I think it's this week. So it would be good, frankly, to have the MAC appoint somebody who can participate. It can be one or two people in these meetings. And Marilyn, I know you live in the city part of El Sobrante. It would be great having you involved as well. So, I mean, the MAC can appoint two people, one or two from the MAC, but people don't have to be on a MAC to be involved. So, and since you're you're in the Valley, and as you know, part of the Valley's unincorporated, and part is in the city. And so provide us your contact information and we can put you on the list. You sound like you would be a good connection to your neighborhood council to reflect their feeling, because you're on the interface. We've had a number of productive meetings and we had a very long discussion with the East Bay Regional Park District Fire Chief. They're also their park director, Elizabeth Eccles, to talk about exactly these issues. And there's been some interest of maybe of all these agencies forming a joint powers authority. So please send it's all about this issue. It's and so my ask is send James your contact, and then we can put on the list, and Tom on the MAC to have in fact, if get some volunteers who on the MAC would be interested to be a liaison on this issue.
I know Ms. Shirley.
We have one. So Pastor McLean. So you're at Melinda. Okay. So
I'll add her.
Keep track, and then both of you will let you know when our next meeting is. Since we actually had a better turnout on our Zoom meeting than we did at the meeting. We had a meeting in Kensington pre-COVID. We had more people on our Zoom meeting. So good. Got 2 new people. We just recruited 2 new people from El Sobrante because that would be really important.
And Richmond is missing some representation. So Marilyn, you would be perfect for that. Tom Lang, you had your hand up and then it went down. Did you have a public comment, Tom?
Yeah, I was just very concerned about fireworks.
Yeah.
And I don't know about everybody else, but it's certainly something that my neighbors all noticed, was that the volume and the size of the fireworks this July 4th and the days around it really increased. So not the usual M80s that we've seen for the last 20 years or so, but huge professional grade fireworks going up in our neighborhoods. And just the fire danger, wildfire danger that this poses is incredible. So I put my hand down because I thought to just better say it in an email, but I'm wondering, how can we put together a plan to really try and curb that?
I can just, I was in contact with our fire chief that night, and I've been in contact with local police chiefs. Let's hope this year was an anomaly. This was the worst I've seen. And this was a national phenomenon. It wasn't just local. It was worse in some places. I mean, across Richmond, it was very severe. And people are sort of crediting several reasons for this. One is this shelter in place, people coming out of that, feeling sort of a need to do this. Two, that many of the official city fireworks celebrations were canceled. So people decided, instead of going to some, as you know, there's a number of celebrations in West County on the 3rd and 4th of July. And so people did something different. And third, there was maybe a large supply of unbought professional grade fireworks that would normally be purchased by the official fireworks celebration. So in fact, I know the Contra Costa Fire was out with 50 calls during the evening. There were all the fire engines of all the fire agencies were out responding. It was a dangerous situation, as you say, fire risk. So, and I heard from many people saying, well, more outreach to tell people it's illegal. Well, I think people know it's illegal. And yes, there may be more continued outreach, but people chose, unfortunately, across the country to participate in illegal fireworks. And to be honest, I'm not certain what the police agencies could have done more or differently. I know they were all out that evening, and even in the build up to it, they were trying to be out but it was hard to identify. So let's hope this was an anomaly.
Thank you. George Cleveland.
Thank you, James. About the fireworks, I've lived in El Sobrante for 16 years now, and by far that was the worst ever. And it's a lot of things, having people being cooped up. And I have a different perspective on fireworks and things than the rest of the people here, because I live next door to what is essentially open space in a memorial park. And I get fireworks and other things on a regular basis throughout the year. So, but still, it was crazy. But it also ties into people, because there was this post on Nextdoor, and someone was asking, in all seriousness, we thought at first the person was being a troll, but in all seriousness, hey, where can I buy some fireworks? And we're like, are you kidding me?
Saw that.
Really? Where you want to buy fireworks? So that type of thing. That was one thing. The other thing I want to talk about too, and Marilyn jogged my memory about things that are overhanging. And this is a chronic problem. It's on Hilltop Drive. It is the house at the corner of Alhambra and Hilltop, just past the entrance to Rolling Hills and across the street from the Mini Mart. There's a tree that grows at the edge of their property, and it overhangs Hilltop. And the problem with it is that it blocks two signs. One that indicates that there's a crosswalk, because there is a crosswalk, and also the 25-mile-per-hour speed limit sign. There's one as you're coming up the hill from the freeway, but there's a second one that's there, and you can't see it now. It's blocked. So, and that's a problem, because people tend to use that little stretch of street as a throughway anyways. They think it's fun to speed up and down at 40, 50, 60 miles per hour. So that tree, and it's the Public Works has done it before. They've cut the tree back. And once they do that, it'll help, because you can't see the speed limit sign. And if the police were to pull somebody over and cite them, they'd say, well, I didn't see the sign, and they'd have a legitimate gripe, because it's covered. That and the crosswalk, the indication of the crosswalk sign as well. So if someone could have those trimmed, that would be helpful.
I will call code enforcement, George. And
also, I just want to thank you for setting this up. And don't take this the wrong way. I hope I'm paying you a compliment. I like the look you're rocking right now. I call it the 70s retro look, and it looks really cool. So
I'll keep the fro around.
Thank you.
As it relates to that home, so there have been issues in terms of communication with the property owner for the entire time I've worked for Supervisor Joya. Mm-hmm. And one of the things that code enforcement has shared with me, and then one of the reasons that I mentioned it earlier, is people are ignoring their notices right now. Oh. So there's about a 6-week process from the time you are issued a notice to comply to the point where the county could remedy it and then place a lien on your property to recoup the costs. But in this COVID time, not so much. And our code enforcement managers told me straight up about 2 months ago that they are experiencing something that doesn't typically happen. People are just not acknowledging their notices. People are, their money is spent doing other things. So I'm asking not to tell on anyone, but genuinely as it relates to weeds and bushes and trees, do let me know. I'm happy to contact our code enforcement folks who are not punitive initially. They go out and they knock on doors and try to have a discussion. They don't want to write violations. But if you're seeing it, especially, George, you pointed out probably one of the most egregious homes in El Sobrante. That corner has always been bad. I live in Hilltop Green, so I drive out every single morning and I see it. But I will let code enforcement know. You may have noticed that it was trimmed a little bit in the last week or so, but I'll let code enforcement know to come back and ask them.
I haven't checked in a while because I work from home, and my going out, as it were, entails me going out to the end of my driveway and getting a newspaper. That's my going out of the day. So.
Okay. Are there other persons that'd like to speak for public comment? Yes, Joni, go right ahead. Please unmute yourself, Joni. There we go.
I just did. Thank you. Just to add to the fire escape route concern, and I know many of these nice people who are on here, we were on a call with the Contra Costa coordinator on Wednesday, but I am in the Greenbrier section of Richmond, very close to Castro Ranch Road, and it's a huge worry for all of us in both Carriage Hills, Greenbrier, because Castro Ranch Road is our escape route, and it is so overgrown, and we're all very concerned, and many of us are trying to remove trees, harden our properties, all those buzzwords I learned the other day. And I know it's a huge issue and it's a huge coordination problem, but we're all very concerned out here and would like to do whatever we can to help. And I appreciate Ms. Bonna's leadership and Ms. Sarney, and thank you all for whatever you can help us do.
So how do we connect with you on this? If Marilyn's involved, or you're going to want to be involved, or Marilyn can reach out, do you have a mechanism where?
Well, I'm part of the Greenbrier Neighborhood Council. We're Richmond, John.
Yeah, I know Vicki Winston, who was active out there.
Vicki's around the corner from me.
Yeah,
She's
tell her hi for me.
I will.
Yeah. So
certainly give you my email, Dave Zuckerman, and some of our neighborhood council people. We butt up with May Valley, and so we're all very concerned out here.
will you send James your contact information?
Yes,
and then
sir.
we'll put you on the list. Actually, this is great that we're getting because from El Sobrante, including the Richmond side. Yes.
I'll do it.
That's great.
Do it.
Terror. It's caused by sheer terror.
Yes, it
No,
is.
I mean, with the park district, I mean, the park district did an EIR a number of years ago for vegetation management, and they're implementing it now. There's still a lot of community concern about doing more, and so this is sort of the issue: is how do we work more? And the fire chiefs are at our meetings with the park district, so it's a good way to talk to them.
Great.
Yeah.
I'll get you my email. Thank you all very much.
Okay, we are going to have a separate meeting to address our planning applications. I will contact the MAC members about that. Mickey, I wanted to mention, I did create the illegal dumping page, but it would not post. So I have a trouble ticket into our Tech Folks Civic Plus. They are going to fix it, but I did create the page. When I went to post, it froze the entire computer and I couldn't get back in. So you are like, I'm trying to keep a straight face with you all with the thumbs up and down. But I wanted to let you know, Mickey, that I've created it. It will be up hopefully before the week's out. They'll be able to fix it via the trouble ticket. But I also wanted to take this time, the last thing on the agenda, Mickey, if you have comments that you'd like to make about illegal dumping, if there's something that you'd like to say, the floor is yours to do so.
Yeah, thank you. I haven't had any meetings, but I try to keep an eye out when I go out, which is not that often, but I'm surprised that there isn't more illegal dumping. I thought, especially at the beginning, when people were home and cleaning a lot. I was expecting to see a lot of dumping on the streets, but fortunately, I didn't see that much. I don't know if other people are seeing it. I do report it, and I encourage everybody to keep reporting it to Lynn Clark at Public Works. If you do notice any dumps, they have been taking care of it. Take a photo of it, send it to Lynn Clark. I could post her email in the chat after I finish speaking. But so I'm a little bit encouraged that we haven't seen a big uptick in the dumping. I'd like to hear from other people if they have seen spots around town that they think need to be addressed. Melinda, what are you seeing?
We had yet another big dump behind the good table. And the only reason I unmuted to say this, because James helped me get through to Public Works to get them to come. It was a dryer and a huge sofa, and somebody just dumped a lot in our back driveway behind a dachi. I cut and pasted the email off your flyer, and it had a typo in it. Ooh. So I didn't get through to Lynn Clark. And so James caught the typo, and I finally got through to her. But you might want to double check your flyer. And
I remember it's a C. We're missing a C in CC
there was
County.
A C missing in there somewhere.
At pw.cccounty.us.
Check that flyer, because I think it's got a typo in the email address.
Okay.
It came out really pretty quickly. Public Works seems to have kind of faster response times at the moment. Now that could change.
Good. I have
was very grateful.
So I go on some long walks around El Sobrante.
We're taking more walks and picking and things like that. Am I frozen, or can you hear me? Yeah. Yeah. Okay. So I'm just hoping maybe people will take a trash bag, either wear your gloves or take something and try not to touch other people's trash. But it'd be helpful if people can just take it upon themselves for that component. And I'm going to finish typing in the address to Lynn Clark, so people can report directly to her. She's been great, and on it and adds it to her list. And so please continue doing that, and we'll be our a group effort to manage this while we can.
So what I do typically is I take a picture of whatever it was that is dumped, and then I send that to Lynn with a pretty precise description of where it is, and it gets taken care of right away.
Address and cross street. Whenever you send Lynn an email, if you've got an exact address, if it's in front of a place and you can send that, perfect. But if you have an approximation, please send her the nearest cross street in addition to the street that you're observing it on. One other thing I'd like to mention, I hope everyone has noticed the work that has happened on San Pablo Dam Road. Public Works got out there and paved. Paving doesn't happen that fast. I drive up Dam Road all the time, but they got out and knocked that 3-mile stretch out quickly. One of the things that during this time, Public Works has been able to get to their projects and move right through them without the additional, haggle of traffic and things like that. So I hope that folks have noticed that. I'm not sure if the speed feedback sign has gone in, but I will take a look out there and then report back. If there are no other public comments, I'd like to also mention that there's still a vacancy for an alternate seat on the El Sobrante MAC. If you are interested, please email me and we can set up a virtual interview with you and Supervisor Joya. Tom Lang, do you have any final closing remarks?
No, just I want to thank all of our speakers, John and Dr. Parnitano, and all of you for attending our meeting. And I think it's time to adjourn. So best wishes to all of everybody, and let's all stay safe.
Thank you. John, did you have anything to say in close? Oh, good. Okay. Thank you, everyone.
Thank you.
Thank you.
Stay safe and well.
Thank you, everybody. Take care. Stop the recording. All right. All right. Okay. Thank you. Thank you. Okay. All right. Well, I think that's the end of that. Take care, everybody.